Good morning, everyone. I appreciate you taking this time this morning to join us to learn about vaping. I was kind of surprised at how prevalent it is in our elementary schools. We've been finding things on our playground and everything, so I think this is really important as parents. I know I have a 12-year-old, so I'm really looking forward to this presentation today. I would like to thank Carolyn for doing the presentation. She is a consulting contractor for the tobacco section at MDHHS, and I'm going to let her tell us a little bit about herself and go ahead and start the presentation. If you have any questions that you would like to ask, feel free to type those in the comments. And this is being recorded, so if you have friends that want to watch it or a spouse, you can do that at a later time. Thank you.
Thank you so much. Good morning, everyone. I'm very happy to be here today to talk to everyone about this epidemic of e-cigarettes or vaping products. A little bit about myself. I'm a consulting contractor, as Marcia said, at the tobacco section and over at the Michigan Department of Health and Human Services. And my specialty is youth and youth projects across the state of Michigan, specifically with e-cigarettes. So I am the subject matter expert here in the state of Michigan. So I am very happy to be able to share everything that I know, and that I'm also learning a lot every day. Things change. So very happy to be here. So what I'm going to do is I'm going to go ahead and share my slides. So just bear with me for just one moment. Okay, and I'm going to go ahead and put that in slideshow mode. All right. So basically, this is just our intro slide. Again, today we're really going to get into talking about, we're really going to talk about how to identify these e-cigarettes, these vape products, how they operate. It's really important especially as for parents, to be able to visually identify them. So today, what I do have is several products that are very popular. So really get yourself familiar with these products, and then you'll be able to, spot them out, and you can talk with, either your kids, family members, family friends about them. Then I'm going to talk about some public health consequences. We're going to talk about health and safety concerns, and also those social concerns, because we do know that using these products has a very social aspect to it. So it's becoming a social norm for our youth to use these products. I'm going to talk about why our youth and young adults are using these products, talk kind of a little bit about what's happening here in Michigan, and then I'm going to leave you all with some great resources at the end. So this is an image of a few e-cigarettes, or what we call vape products. This is from the CDC, and unfortunately, these images are always changing. So there's always new devices coming out, on the market. So it is kind of hard to always keep a picture up there that is very up to date. But what I will say is that here on the left-hand side, these are some of the first generation products. So like the tanks and the mods, you may have heard of those several years ago. And then there's also the rechargeable ones right here in the middle, like the Juul, which I'm sure many have heard about Juul. And then also another company called Soren. And then on the right-hand side, there's disposable e-cigarettes. Our disposable e-cigarettes do not look like this anymore. They don't look like combustible cigarettes. So in just a little bit, I'm going to get to what some of those products look like. And then, yes, you might be thinking, oh my goodness, what is this circular disc that's here? This is also an e-cigarette. To me, it looks like a woman's compact. It could be a little mirror. I know I carry around a little compacted mirror in my purse, and it looks just like this. So again, many of these products are on the market are made to not look like a combustible cigarette. All right, so what is an e-cigarette, and how does it kind of work? So this image that I'm showing you here is a first generation e-cigarette. So they don't really look like this anymore, like I just mentioned, but all of the same components are there in these newer generation ones. So I'm gonna go ahead and get my little pointer here. I'm gonna do a little laser pointer. hopefully you'll be able to see that. Let me go ahead and do a little, okay, or, oh, no, that's a little pencil. I want to do the little laser pointer. Okay, so here you can see that when someone who is using the products, when they inhale here, an LED light is going to go on. That is going to trigger a battery, a voltage control, this heating coil, and this chamber that has the liquid in it. So they call it the vaporizing chamber. So what's going to happen is when somebody inhales, it's going to trigger this system, and you are going to inhale the liquid form into an aerosol form. So as I mentioned, they come in many different types: disposables, rechargeables, refillables, but the same thing is in these products. So we're talking about our liquid nicotine or our other liquid substances that could be found in these products. Okay, so e-cigarettes can be used for more than just e-juice. So when I say e-juice, I mean that, that liquid nicotine. So a third of US middle and high school students said that they use e-cigarettes with non-nicotine substances. So what does that mean? Pre-COVID, I used to be in the schools a lot. I used to do a lot of professional developmental days for teachers and staff, and really be out there in the communities. But now with COVID and during these last couple of years we've had, I haven't really been able to go out there and do that. But when I was out there, a lot of students were telling me, you know, in these focus groups saying, oh yeah, like I've heard of people saying that they use it with marijuana, with the THC, they use it with bath salts, or they'll crush opioids and make their own solution and put that in there. Or they'll use alcohol, or they'll use heroin or cocaine, like, you know, very serious drugs here that we're mentioning that could be used with these devices. And it's very hard to know which substance is being used because, you know, when it's in these devices, you can't tell right off the bat what that is. But 1 in 3 youth have said that they've used marijuana in its liquid form THC with the Juul device. And something that's very problematic that I want you all to know is that when you heat these hash oils, so this marijuana in these devices, that can reach up to 95% pure THC, which is that psychoactive component in marijuana. Versus when someone uses marijuana in a joint or blunt form, that only reaches 7% pure THC. So now we're having these high concentrations of any substance really that you're using in these devices increase that potency that's being used in the device. So high concentrations of THC could cause side effects like temporary psychosis. So again, these devices can be used for more than just the liquid nicotine. All right, so you heard me say the word aerosol a couple times already. And that's because when someone inhales and exhales the liquid e-juice that is in there that's then converted to the aerosol, that is an aerosol. It's not a vapor. So this is one of the biggest misconceptions that is out there right now, is that this is a harmless vapor that's being inhaled and exhaled, but it's not. It's actually an aerosol. So it's comparable to, I would say, the aerosol like that's in spray paint cans and hairspray. And I like to show this visual because when I made my tea this morning, I used my hot water kettle and I did see that steam come up. You know, when you boil a pot of water, that is vapor. That is harmless steam that is coming out of a kettle or a pot of water. It is not aerosol. So these devices, when you inhale and exhale, it's an aerosol. Just wanted to really make sure that we all understand the differences here between aerosol and vapor. And this is an image from the CDC. It is a great infographic to share, to have on hand. And again, CDC does call it an aerosol. So in this infographic, you can see this woman is exhaling. And what is in this exhaled aerosol is the same that can be inhaled as well. So nicotine, organic compounds, ultrafine particles, cancer-causing chemicals, heavy metals like nickel, tin, and lead. And this is something that was not in our combustible cigarettes, nickel, tin, and lead, because there were no metals, in a combustible cigarette. This is something new that's in these devices. So again, that nickel, tin, and lead is very problematic as well. And then flavorings. There is a flavoring called diacetyl, and it's a chemical that's linked to very serious lung disease. It's similar to COPD, It's called bronchiolitis obliterans, and the more common word for it is popcorn lung. So you may have heard that term before. Again, these lung diseases are very serious, irreversible. Like I said, they're very similar to the COPD. But it's linked to these flavors. And we know that the flavoring is something that is very much so attracting our youth and young adults to want to try these products. So I mentioned the cancer-causing chemicals, and I mentioned, that there's thousands of chemicals found when you inhale and exhale these e-juices and substances within these products. It's very hard to remember those long names, those long phrases and terms. So what I like to do is I like to put some common items up on the screen here so that when you are talking to people about these devices, be like, hey, did you know that there are chemicals that are found in batteries, nail polish remover, antifreeze, paint thinner, herbicides and pesticides, gasoline, rubber-based tires, oil-based paint, all of those chemicals that are found in those things, that's what you're breathing in. So it's really easy to relate on a level that people can understand. So that's why I really like to put these items up here, because a lot of people know and understand these common items that are up here on the screen. So what e-cigarettes are not. So this is a very important slide, and I really want everyone to understand this slide, because e-cigarettes are not an FDA, so a US Food and Drug Administration quit tobacco device. So they are not a quit tobacco device. And so they shouldn't be marketed as such. And this is something that's also attracting our youth, because it says, oh, like it's a new safe cig, it's an e-health cigarette, don't, and if someone is using combustible cigarettes, they might say, oh, you don't need to quit. You can just switch to using e-cigarettes. There's no ash, there's no smell, there's so many flavors. You can use this product anywhere. So again, products should not be marketed as a safe or safer alternative. So now I'm going to get into some of the products, because I know this is something that probably many of you are here to try to learn and, take away from today's, training session here. So this is the Juul. This is a very popular device, still very popular amongst our youth and young adults. It really dominates our e-cigarette market here in the US. It's very sleek, very small, very slim. It can fit right in the palm of your hand. And this is something that I think is so important, is that it looks just like a USB stick, just like one of those thumb drives, right? So the device comes in 3 parts. You have the charging station that looks just like when you put something into your laptop, or, when you're charging a charging dock for something. And then the body of the device has that battery that I mentioned before, that actually will heat up that mouthpiece or that pod right up here at the top. So in this pod, it has the e-juice in it. It has that heating coil, and then this mouthpiece that lets whoever is using the product inhale. So this goes into the body of this device. And here you can see that it fits like very nicely in your hand. Usually a lot of our youth don't hold it like that because they've never used combustible cigarettes before. So they usually hold it between their pointer finger and their thumb. And they'll kind of take a hit off of that, and then they'll hide it again in the palm of their hand. So something to know about these pods is that one pod, this is about the correct size on the screen here when you look at it. The pod is roughly about the same size here, is that one pod is equivalent to about a pack and a half of cigarettes. So a pack and a half, what I mean is a pack and a half worth of nicotine, a pack and a half worth of those carcinogens and toxins. And unfortunately, when we were doing surveys and focus groups, there were students that were saying, I go through 2 of these pods during school. I go through 3 of these pods during school. So when we think about that, 3 pods times a pack and a half of cigarettes. I mean, we are talking about seriously high levels of nicotine that our students are using in school during school hours. So very concerning. And, you know, this here is probably one of the most popular ones that you will come across. Youth have said that it is easy to get these devices. And a lot of them are not aware that Juul pods always contain nicotine. So you may have, you know, your students and your kids say, you know what, but mine says 0% nicotine on it. There's no nicotine in here. It's safe for me to use. It's just flavored water. You know, this is not true. So it's a very big misconception. And about half of those students who were aware of Juul said that they thought that it was less harmful than cigarettes. So, you know, we have a lot of perceptions going on with our youth and our young adults surrounding these products, and a lot of things that they're not aware of, and a lot of misconceptions that are sticking with them as they're using these products or trying them for the first time. So this is an older device. I won't spend too much time on this one because this is something that I remember seeing a lot when I was an undergrad at Wayne State. This is like a first generation tank that they call it. It's very heavy. It's very expensive. So a lot of our youth are not going to use that. I think many of our adults now who are using e-cigarettes like to use this one because you can like control the heat, which means you can control the amount of concentration, the potency of the substance that you're using will get. But again, it's very heavy and it's hard to hide. So a lot of our youth are probably not really using this one. All right, so e-juices, what do they look like? If you're not using a Juul that has the pod, you may see some of these bottles laying around, you know, either room, locker, garbage. As Marcia said, you know, we're seeing them trash outside school in our parks and playgrounds, things like that. So you might see something like this. These are older generation e-juices, how they used to be promoted. Notice the difference, you know, like these bottles here on the right-hand side are colorful. The flavors sound great versus here, this kind of just looked like an eyedropper or an eardrop. And the flavors didn't really look that appealing. You know, I don't know what a cowboy blend is supposed to taste like, and I don't want to find out, but the pineapple fruit splash or a rainbow drop sounds much more appealing to our youth. The packaging, as I mentioned, is something that also draws in our youth and young adults. And something that I wanted to mention too about these rainbow drops is that their slogan is vape the rainbow, very similar to Skittles, taste the rainbow. So again, these companies know what they're doing to try to target our youth to want to try these products. So this is just another device, looks very similar to the Juul. It can hold pods, or you can refill up at the top. There's actually a spot where you can put in the e-juice yourself. So the price range is about this now for Juul. Juul used to be a little bit more expensive, but they, you know, noticed that other companies were trying to do knockoffs. So they needed to be a little bit more on par with the price. These ones here, again, some of them that are very familiar to many of our youth. Before the pandemic started, I did a couple presentations at some of our universities here in Michigan, and I actually brought these devices with me. And I said, hey, can you guys tell me which devices are popular and what's being used? And so I probably had about 30 devices in front of me, and they were like, pushing the ones aside, saying, these are the ones, not this. This is what I use. So these 4 here are also very popular because they also don't look like a combustible cigarette, right? They look like other items. The Soren drop looks like a highlighter, or it looks like those kind of sports drink drops that you would put into your beverage to, you know, give you extra electrolytes and that kind of thing. This one looks like a battery pack. I have a charger for my phone when you're out and about and your battery starts to go dead. I actually had a teacher tell me after a presentation one day, she said, oh my gosh, I had no idea. I was charging this device at the front of my classroom for a student one day because I had no idea it was an e-cigarette. I thought that it was a battery pack for something that the students were going to need later on in the day. So I mean, just imagine, you know, all the students knowing that this is an e-cigarette that's being charged in the front of the classroom. And, you know, our teachers and our parents just don't know about these products. Again, I showed you that circular UFO in the beginning of the presentation today. This is a double cartridge. So there can mix and match flavors. I used to go undercover a lot to many of our tobacco shops across Michigan, or a lot of our e-cigarette vape shops, and actually picked this one up because I said, hey, you know, like I was pretending that I used e-cigarettes, and I was like, hey, I want something, you know, that won't really get me as recognized of using a product. And they were like, do you carry a mirror in your purse or a compact? And I said, yes. And so they sold me this one. So again, people at these shops, they understand and they know what is popular, and they know what people want to see. So this again is just another product. Here they say now that it's here for your protection, for child safety, because many of these products unfortunately are also causing overheating. So they're burning people and they're exploding. Yes, you heard me right. They are exploding and causing burns, very severe burns to people who are using them. So here, this company here wanted to say, oh, this is for your protection. When you hold the button down, it'll turn the battery off. You know, we have tried all of these products to see if they do shut off, like, you know, not try them, but we have held the button down to see if they turn off. Unfortunately, they do not. Again, another device that's here to try to protect, you know, child-proof locks for safety, to make parents think that it's safe to have around the house for around their infants and children. Unfortunately, again, that child lock does not work. So again, these companies are trying to promote safety of use around these products. Now, this one here does not look like an any of the e-cigarettes that I showed either. This one kind of looks like a lighter, but for me, it kind of looks like a GoPro camera, and you can fit it right in the palm of your hand, and it comes with a lanyard, and it says, you know what, this is here for your decorative and portable purposes. You know, we live in a beautiful state of Michigan where we have parks and beaches and you know, beautiful, beautiful recreational spaces. And, you know, I would never have guessed that, you know, if I saw this hanging around someone's neck or arm, I would not think that this was an e-cigarette. So again, another one just to be on the lookout for. And then these are the disposable e-cigarettes. So these ones are ones that are very popular. During the pandemic, the usage of disposable e-cigarettes actually went up over 1,000%. So we know that a lot of our youth are moving to use these disposables because it's kind of like a one and done. So, you know, they use it until they can't anymore, meaning that there's about 200 to 300 puffs that you can take for these devices, and then they're just thrown away. And then another thing too, that they're not as expensive as the other ones. So if someone is caught using the device, they can easily be like, throw it away, or be like, oh, I'm not using it. Like, this isn't mine. But these come in so many flavors. I mean, the flavors are endless. There's over 15,000 flavor combinations right now that are out there that our youth can get their hands on. So as I mentioned, you know, the nicotine content is very high with these products. This is a great visual from the Tobacco Prevention Toolkit that's from Stanford. And it just kind of shows you the differences of the products, of how high the nicotine content is. And I really like this progression to show you this, is because not only do you see the number, you know, that milligram number of nicotine, because sometimes that can be confusing. But here they show the visual. They say, this is how many cigarettes is comparable to what you're using in these devices. So, when we talk to our youth, when we talk to our kids, when we talk to our students, this is something that I think a lot of them don't know. So this would be something to really talk to them about. So these are just a couple other ones that are out there right now. These ones were on the must-haves for the 2021 list. The Bitty Stick is gaining a lot of popularity over here on the left-hand side. And then these ones here are just other ones. They look very similar to other devices that I've shown you. So these are just other companies that are creating products that look like other ones because they know they're popular. And again, they come in like these bright colors, very cool packaging. The flavors sound great. The sweet grapefruit ice, strawberry ice. Again, these purplish colors, very small, all can fit in the palm of your hand. And then I know that we're talking about e-cigarettes, but I really wanted to take a second to tell you that now there's something that is called a loosey gum, which means that these are actual like nicotine gum. So it's not like the nicotine replacement. It's not like, when we're talking about like the Nicorette gum. This is actual nicotine that our kids, our youth, our young adults are using instead of, using the e-cigarette, using, the smokeless, the chew or the snus or the other smokeless forms of tobacco. So again, in the form of gum, we're seeing more ways that these companies are getting creative to get nicotine and to get our youth addicted to nicotine. Again, this is not an e-cigarette, but these are other ways that, our youth can use tobacco. They're in pouch form, so they kind of just fit right in between your cheek and your gum. And these all come in flavors as well. So I just really wanted to put that out there, that there's other types of tobacco as well that have flavors that our kids might be using. So this image here for me is very concerning. This looks just like an inhaler. This is actually a device that's used for THC, for marijuana, and it's called the Puffit. Again, very, very concerning. Before I started my career in public health, I worked as a pharmacy technician, and I can tell you that there is never on the market a inhaler that is all black like this. So again, this is a little bit more expensive. So I'm not sure if, how many of our kids are really going to be using that one. But again, very concerning. I mean, imagine if, we have kids are playing outside and someone needs their inhaler and they say, oh my gosh, my inhaler's in my bag, and all the kids' bags, are already stacked up. Kids, they run, they throw their bags down, they go play. What if someone goes into the wrong bag, pulls out this inhaler and gives it to someone who's actually needing to use an inhaler, but instead it's actually an e-cigarette product. This one here, not so much with our youth. This is something that our adults are kind of starting to use. I quit ordinary smoking, so it's called a heat not burn cigarette. So I'm not going to get too much into this one because our youth really don't use this product too much. But as I mentioned in the beginning, this is an epidemic. This is a public health epidemic, and our U.S. Surgeon General, our previous Surgeon General, Dr. Jerome Adams, he declared this a public health epidemic. So this is kind of just a little excerpt from what he said. We must take action now to protect our health from our nation, of our nation's youngest people. So this is still an epidemic. And so something that everyone should still really be aware of and know that it is happening. It is happening here in our state of Michigan. It is happening in our counties. It's happening in our schools. So this was a 2019 data survey saying that about 6.2 million US middle school and high school students in the past 30 days were using some form of tobacco. And you can see that e-cigarettes was the highest form of tobacco that was being used. In 2020, they said that 27.5% of students in 2019 versus the 19.6% in 2020 for our high school students. And then our middle school students showed a little decrease as well from 2019 to 2020. It is still noted that 3.6 million youth still use these products. Even though the national average is going down here in Michigan, we still see those numbers increasing. So unfortunately, numbers in Michigan are still increasing of usage. We will be having a youth tobacco survey that's going to go across the state of Michigan coming up soon. And so I'm hoping that we'll get a more definite number for each county as well, which every school that's going to participate. So we'll have more, current data for 2021 coming up pretty soon. But the adolescent brain is still developing. We know that the human brain matures at about age 25, 26. So all of our kids that are in middle school, high school, elementary school, their brains are still developing. Our brains are making these synapses. And, when nicotine is introduced to that just studies have showed that nicotine addiction will happen the earlier one starts to use these products. There have been mood disorders, lower impulse control, attention and learning problems that have happened because our youth are starting at such a younger age to use these products. And as I mentioned, those synapses are being formulated in our brains. And so now they are learning that the nicotine addiction is, the nicotine is there. They want more nicotine. They have to have nicotine to feel good, to feel happy. So again, very dangerous for our youth to start using these products at such a young age. The common myths that I mentioned, we have many of them, but these are just a couple of them. I hear these on a regular basis. And this is going to be a really good slide for you to kind of review before you want to go ahead and sit down to talk with your children, with friends, family. I'm also going to have a really good resource to give about how to start the conversation with your child or with any other type of child that you want to talk to about this issue. But these are just some of the things that I would be prepared for before sitting down and talking to your children about. They're going to say it's just water vapor, or it's just flavoring, or my vape says it's nicotine free. I won't get addicted to them. Don't worry. Or I don't have an addictive personality, so I won't get hooked on vapes. Or they'll say nicotine isn't bad for me, so it's okay for me to use it. Or they'll say, just because I use these devices doesn't mean I'm going to smoke cigarettes. But all of these myths have been, should I say, like debunked. And we have a lot of articles that go against what these myths are to show that, yes, we have research that shows that these are dangerous products, that the flavoring is linked to very serious lung diseases that don't have a cure. Remember, it's irreversible. This is irreversible damage. So why the rise in e-cigarette usage? I've kind of started talking about a couple of these, so I might go a little quicker through some of these slides. And if you would like to see these slides, I know that we're going to have these available for viewing, and we are recording, so we can always kind of pop back and take a look again at a lot of these slides. But again, these flavors are very desirable. I mean, on this slide here, everything looks so good to me. When I was a kid, I remember always running after the ice cream truck for this boom boom popsicle, so they're trying to be very nostalgic, and they're trying to get flavors that they know that our kids are going to want to try. And again, 15,000 flavor combinations are there. And social media, we know our kids are on social media. We know our kids are on their phones, laptops, computers, iPads, everything. So social media has a very big impact on the way that our kids see these devices being used, on the way that our kids think about how it's a social norm now to be using it. And you have famous people, actors, actresses, models, musicians. You have people who are showcasing themselves using these products on these social media platforms. And so when we have our kids thinking, oh my gosh, like these athletes, these musicians, these actors, actresses, these are my role models, I want to be like them. And they see them using these products, and they see that their role models are in their prime of their careers, they think, well, if it's safe for them to use, it should be safe for me to use, right? So again, it's very difficult because we have so many influencers who are showcasing that these products are, something safer to use. Again, social media is also going to be there for their advertisements. These look very attractive. This here is just like Starbursts. And now we're getting to Halloween time where candy is always on the shelf and everyone's advertising candy. But these ads are popping up on social media, and they are being shown to our youth that's saying, oh, like you can get like a huge bottle of the burst, get 2 for $40, or you can get strawberry donut, and the flavors go on and on. But this is what is out there right now. And unfortunately, we also are seeing some very serious false medical advertising as well when it comes to COVID. And unfortunately, many of these e-cigarette companies in the very beginning of the pandemic, they were promoting free giveaways of masks and protective gear year when we were at a shortage of that. And they were saying that if you buy our product, we'd send you a free mask. We'll send you free PPE, and we'll give you 19% off if you buy now. Also, I mentioned the Biddy stick earlier. This one really got me very upset. So I had to take a screenshot of this one because this is an unproven illegal health claim. They're saying that a Biddy stick a day keeps the pulmonologist away. They're saying that if you used these Biddy sticks, that it would actually mean that you would be safe and protect your airways and throat. So again, this one specifically gets me very upset because my husband is a physician and he is specializing, with pulmonology and critical care. And so to see this slide, I was like, my goodness, like what will they not say to try to get people to use their products? And then again, lack of regulation. There is some things that are going on with the FDA right now with some of the regulation authorization of some of these products. But again, these products could be found in the gas stations, right by the candy, right by the gum, right out front when kids would go pay. So some health concerns, I really wanted to make sure that we don't forget to talk about this because it is very important. And this is probably one of the other reasons why you're all logged in today is to learn, well, what is the concerns? What do I need to be worried about? So the FDA has reported several of these health concerns, all of these here. So there are many more that were being reported, but these ones were ones that I found that I thought were very important to relay to everybody. So it has been reported that impacts with pneumonia, asthma, cardiovascular disease, skin disorder like contact dermatitis, oral health like mucosal lesions. My uncle is an orthodontist and I asked him, I said, can you tell when kids come in if they use tobacco, if they're using the e-cigarettes? And he says, absolutely. Their gums are just very different. They have, sometimes their cheeks have, like I said, the little sores on them. And if you're using very high levels of nicotine, your tongue can kind of start to discolor and, it affects your taste buds as well. Disorientation, seizures. There were a couple of years ago where there were a large number of cases in a few of the states that many of their youth were having seizures. The lung injury, the EVALI, right before COVID, we were talking about this outbreak across the country, and also here in Michigan, we had many of that lung injury happen. And unfortunately, people have died from using these products as well. So the symptoms, I know it's going to be very difficult because right now we're still, in the middle of the pandemic for COVID. So many of these symptoms might sound similar to those for COVID. So, but the main thing is that if you use an e-cigarette within, the last few days or weeks, a lot of these symptoms that you may not have had before would come very quickly. And it's usually the shortness of breath that will make someone ask for help. So e-cigarettes and lung health, we know that e-cigarettes can lead to the coughing, the wheezing, the bronchitis that doesn't go away. It's going to harm the lungs and breathing troubles. And then also, like I mentioned, addiction to other tobacco products is a very high possibility. The American Academy of Allergy, Asthma, and Immunology website said that people using e-cigarettes are 2 times more likely to start to have breathing problems like asthma and ongoing bronchitis. And also, if you do have asthma, you're more likely to have that trigger an asthma attack when using these products. Okay, so e-cigarettes and COVID-19. I'm thinking that you guys probably were like, well, tell me more about this too, because COVID attacks the lungs and the e-cigarettes attacks the lungs. So our director, Dr. Nora Volkoff, I had the privilege of being on a conference with her and hearing her talk about e-cigarettes and COVID. And these are just some of the takeaways that she said. Because it attacks the lungs, COVID-19, it's very serious a threat for those who smoke tobacco, marijuana, or who vape, because we know that when you are using these products, it's compromising your lung function. So it's actually not allowing your lungs to respond to the infection of COVID-19 the way that healthy, clear lungs would. So again, another very serious takeaway here is that e-cigarettes and tobacco is definitely a factor for COVID-19 for those to have more serious problems and side effects of COVID. So this was an article, one of the articles that I wanted to put up here too, if you wanted to read more about that. The more you use these products, the higher you are for the infection and for them to be more severe. So I mentioned a third-hand exposure in the health concerns, and something that I think a lot of people don't know about. So primary exposure is when, let's say that your child is using an e-cigarette. That is them actively using the e-cigarette. Secondhand is when they exhale that aerosol, and then it would affect anyone who's in the room with them that could be breathing in that secondhand exposure. Thirdhand is something that a lot of people don't know about. Third-hand exposure is the residue that's left behind after the second-hand aerosol or smoke settles. So I like to kind of call it, like, I know I say residue, but kind of think of it like dust. Like, I know I always feel like I need to dust my house all the time. And, think about third-hand exposure as that dust or residue left behind. It can cling onto clothes, skin, furniture, carpets, toys, blankets, walls, really any surface that anyone using, cigarettes or e-cigarettes, that residue will leach onto those products and anything that's there. And then in turn, that residue left behind still has those carcinogens and those toxins that can then be transferred to someone else who is just a bystander. So why should you really care about third-hand exposure? Because that third-hand aerosol and smoke contains toxic chemicals. As I just mentioned, it can harm you, your loved ones, and anyone else who really comes into your home or space, car, classroom, locker room, anywhere. It's very expensive to try to clean. If you do wanted to try to do a deep clean, let's say, you want to move into a new home and you don't know if someone before you was a smoker or not, you want to try to do a deep clean of things. Unfortunately, third-hand exposure, that residue sticks behind, and it can actually continue to leach out after you try to do these professional cleanings as well. So like I mentioned, how can you be exposed from third-hand smoke from the residue? So people can get from their mouth, they can touch things and then put their fingers to their hands, especially for our young kiddos, our infants, our toddlers, who always have things in their mouth. And of course, they're always on the floor. They're on our rugs, our carpets. They're in the car seats in the car. Lungs, people can still breathe in that third-hand exposure through those particles that would be in the air, or that could also be leaching out from that residue. And then skin, right now I'm sitting at my desk. If someone was using the products in my area, and I sit down and I have my hands on my desk, skin, that third-hand exposure can go through your skin and be absorbed. So these are some of the products that could produce third-hand smoke and aerosol. So really all of these tobacco products, I've mentioned many of these today, but all of these contribute to that third-hand exposure. So safety concerns. You kind of heard me say that there were some burns and some explosions. This here is an image of someone charging an e-cigarette inside their car and it exploded. This is the middle console. See how it melted? This is what one little e-cigarette did. So just a few drops of liquid nicotine can actually result in a trip to the emergency room. Our youth, depending on their weight, it depends on how much a child weighs, that could be fatal, but less than 1/4 of a teaspoon of nicotine could be fatal to a 50-pound child. So there were a couple cases in Michigan about 2 years ago where there were some middle school students who actually had nicotine toxicity. They had seizures in the classroom and had to be rushed to the emergency room. Unfortunately, there were also some cases of some kids who thought, oh, hey, like this is just flavoring, and they added it into someone's drink. And that child then drank the liquid nicotine and ended up seizing and having to go to the hospital as well. Luckily, those cases were not fatal. But just imagine, as I mentioned, many of our kids and our infants and toddlers, they're on the ground, they're reaching for things, they're putting things in their mouth, they bite down on that. We could have serious issues, keeping with the seizures, and then unfortunately death as well. This here is an image of someone who was using an e-cigarette. They were using an e-cigarette in their mouth and it exploded in their mouth. I don't want to scare you, and I know scare tactics don't work very often with youth, but this is something that I had to show you because it is scary and it does happen. This is the C1 vertebrae. You can see that this part of the e-cigarette here was stopped by the C1 vertebrae and it cracked it there. So, the physical and emotional trauma that happened with this individual because they were using an e-cigarette. So this next image here, a little hard to see, but this is a young boy who was using this product, this one right here. This part of the device, actually, the pressure was so much from the aerosol building up that this part shot out into his mouth, broke his jaw, lost some teeth. He was driving and he was in a rural area when this happened. So he had to drive for over an hour to try to find a hospital or an urgent care. And when he got to the emergency room, the doctors there compared it to a close range gunshot wound. That was how serious this injury was. This was how powerful and dangerous this product was. And I mentioned, the social concerns. It's a social norm reversal. People are, thinking that this is the cool thing to do. If you're not using these products, then you can't sit with us. You can't be with us. It's marketing at its finest. It's back on TV, in the workplace, in the schools, many false claims. Christmas time, it's coming up soon again. And this was a billboard that was out there. Again, not sure who this billboard is supposed to be for. To me, I feel like it's towards our youth. And they're saying, hey, like Santa Claus doesn't always use an e-cigarette, but when he does, he chooses Vapor Shark. So again, really serious with, the social concern about how it's just so popular and how many people are saying that it is the social norm to use these products. So really quickly, I want to go through just a couple of, federal laws and regulations that are in place. So December of 2019, the federal tobacco age for 21 was passed. So you have to be 21 or older to purchase tobacco. There was no exemptions to the sales of members of military, and no exceptions basically to anybody, So basically it was raising the minimum legal age for sale from 18 to 21, no grandfathered in. If you're between 18 to 21, you have to be 21. But this law did not address flavored tobacco products. This was just about the selling of the products. And then menthol cigarettes and flavored e-cigarette bans. The FDA announced that they're going to move forward with proposing rules to banning menthol cigarettes and all flavored cigars. So I know that, again, we're talking about e-cigarettes, but menthol is another flavor that really attracts our youth and especially our African-American communities. Many people say that they started by using menthol because it was a very cool and tingly sensation for them. So again, just things that are constantly happening in our regulatory environment here with e-cigarettes. And I know that I'm getting a little close to almost my end time here, but this is an amazing resource. And I really hope that everyone today would visit this website. It's called My Life, My Quit. And we have a Michigan-based website. So you can click on the link here. And really what it is, it's its first comprehensive program designed just for teens. It was designed by teens for teens, and it's confidential, it's free. So your child can call in, they can text, they can chat on the phone or online. They would have 5 real-time coaching sessions, and they would have the same coach throughout. And this website also has some great information for parents, for teachers, for any other type of professionals who want to try to talk to their kids about it. This is just a really great resource. Michigan was chosen as one of 10 or 11 states to pilot this program, and we have been doing so well, and our kids have been actually calling in and using these services. So again, this is a great service to use. It's for those under the age of 18. So again, very good to use for, our middle school, high school, students who want to get help, but don't want to really talk about it either with their parents, or if they want to talk about it with their parents, that's amazing. But that they can also go through, these training sessions. And as I mentioned, they will have the same coach the same time. These coaches have been trained specifically to work with youth, to work with tobacco, behavioral health. So they have been trained in every way possible to really help our youth try to quit these products. This is our website, michigan.gov/e-cigarettes. I'm very proud of this website. I was in charge of overhauling this website with our tobacco team, and it has some great fact sheets, infographics, webinars. The presentation that I am giving to you all today can also in a form be found on that website as well. You can also find the My Life, My Quit materials there. We have tons of resources, one-pagers that can be printed out. We have links for parents specifically in our resources that say how to start the conversation with your children about these products, and just much more that we have there. And if you want to take it one more step and kind of join the fight in helping to try to get these products off the market and keep our kids safe, there is a Keep My Kids Tobacco Free Alliance that you can join. It's amazing. There's so many people and organizations that have already signed on to really be committed to try to help get these products out of the hands of our kids. And there's much more that can also be done. We can try to take local action within our schools, within our communities, try to make sure that our parks and beaches and outdoor areas include e-cigarettes in, the smoke-free areas. Really try to push it at the schools. If your kids are in schools, ask to see that policy handbook. Ask to see if e-cigarettes is included in that tobacco policy on campus of school, because, it is very important. We know that if policy works, policy is going to be one of the best ways to try to keep these products out of the hands of our kids. So really go ahead, look at that policy, look at that policy handbook, look at the school handbook and see if it's in there. I have a lot of other great resources that you can look at, and kids can also utilize these services. So kind of just wanted to kind of put that up there. And then also I mentioned the Stanford Toolkit before. They have great infographics, great quizzes, great information. Anyone who works with kids and youth and young adults, it's an amazing tool guide. And I also have a link to that on our website as well. Again, just a couple other quit tobacco resources. Anyone can always call our Michigan Tobacco Quit line. If you're under the age of 18, it will transfer you over to the My Life, My Quit. Or if someone reaches out to My Life, My Quit and they are 18 or older, they will transfer you over to the Michigan Tobacco Quit line to start to get help for quitting. So this is my contact information. I know that I kind of had to go through some of these slides very quickly because of the time frame that we had. But what I also wanted to do very quick was I have a, let's see, I have a slide set very quickly to show you all from the No Smoke Coalition that is there in Muskegon. So I'm going to go ahead and try to share that quickly. It's just a couple slides, and it's some slides on data. And let's see if I can find it now. Okay. Close out on that. Bear with me here. But in the meantime, if there are any questions, please feel free to put that in the chat. I'll be more than happy to try to answer questions in the time that we have. But so these are some slides that the No Smoke Coalition in Muskegon County wanted me to portray to you. So the mission is to promote tobacco-free communities. And so through that, they do educate, promote, and cessation. So here you can see they educate on the dangers of tobacco use and abuse, including these e-cigarette and vape products. They promote smoke-free policies. As I mentioned, policy is a very important portion of getting our youth protected, and then cessation. So there's also the Not on Tobacco for students and one-on-one for adults. And here we also have a contact information here over at Mercy Health if there's more information that you would like on some of those cessation options for you all over there in Muskegon County. So the MiFi data, the Michigan Profile for Healthy Youth, this is just showing the data for e-cigarettes in your in the region. And this is 7th, 9th, and 11th graders. And it looks like the number has decreased. So that is great. That is showing that people in Muskegon County, the coalitions, the prevention specialists, educators, they're really getting to our kids to try to tell them the risks and the dangers of these products. So that's great to see, the 19%. So here there's also a Quit Vaping, Keep Living. This is a project that was going on with the No Smoke Coalition. So it's a geofencing campaign with youth-inspired ads. This is targeting ages 13 to 24 in all of Muskegon County. So I'm not sure if either your kids have seen these ads yet. It looks like they are up on YouTube. And the goal of the ad is to connect youth with to the new No Smoke Youth website. So I guess there is a new website over there for the No Smoke Coalition in Muskegon County. And it looks, I'm wondering, it would be pretty cool to see if, your kids have actually seen any of these ads, but these ads look, really cool, right on target of, why, they need to quit vaping and keep living. So these are some great ads put together from the coalition. And I think that you all have some great resources there in Muskegon County that you should be very excited for, that is going to help out the community. But I know we are right at 11, so I think I'm 2 minutes over, but yeah. So I am hoping that from today, you all have gained a little bit more knowledge about these products, that you have one thing maybe that you didn't know that now you know, and you can go back and either talk to your family, your friends, your children, friends of family, go back to schools and really try to say, hey, we need to talk about this more. So thank you so much for having me. And Gary will be posting materials and the recording of the presentation once we complete here. So if you need to go back and look on this, this is great. Thank you, Gary.
Thank you, Carolyn, very much for doing this today. And thank you everyone for attending. Have a great day.